So now I'd like to turn it over to Tara and team.
Wonderful. Thank you so much, Lisa. This is Tara Sullivan on the line. I hope everyone's having a good morning, good afternoon, good evening, wherever you are in the world today. We're really excited. This is one of my favorite topics to talk about is knowledge management measurement. And we're going to start off, if you don't mind going to the next slide, please, with a little bit of an overview or introduction to KM measurement at a pretty high level. The team that's going to be presenting today, we had talked yesterday, and there's so much that we could talk about that we realized that today we'll just start at a pretty high level, but if there's interest in subsequent meetings, we could dive in a little bit more deeply. So we'll start with that overview and an introduction to KM measurement, and then we're going to share with you two examples that we're currently working on as part of the Knowledge Success Project. One is with IAPHL, and then the other is with the Momentum Knowledge Accelerator. And then throughout, we're going to infuse it with a little bit of discussion, because some of the challenges that we're helping these two groups overcome are ones that are fairly common when you think about knowledge management and measurement. So we thought it'd be interesting to get your take on those. So with that, we'll get started on the KM measurement, very top level overview. And if you can go to the next slide, please. So this is our knowledge management for global health logic model. And I always like to start with this in terms of thinking about KM measurement, because it gives you that top level view and it gives you sort of a guide for where you may plug in with your specific work that you're doing in knowledge management. So when we are looking at this particular knowledge management logic model, we start with thinking about how we want to, what is the problem that we want to resolve? So in the case of our work, we're looking at how a lack of knowledge can limit the quality of health policy, programs, services, and practices. And then if you look at the very bottom of this diagram, you can see where we want to get to eventually. That is, that health practices and health outcomes would be improved through our effective knowledge management. So as you look at this logic model, you'll see that it has some fairly straightforward and common elements that you'll see in a logic model. On the far left-hand side, you'll see our inputs. So these are sort of the investments that you're going to make in your program, and these are fairly common across many programs. So it's your people, your data and information, technology, financial resources, and infrastructure. Then we get into the middle of this diagram, which is, there's a lot to unpack here. So let me start. These are our processes and our outputs. So if we start with our outer ring, these are our common knowledge management processes. So we go through from knowledge capture, synthesis, sharing, we do knowledge assessment and generation, and this is just a continuous knowledge management process that we go through. As we're going through this process, we wind up with outputs of our process, which are the four quadrants that are in the middle. So we're developing products and services, publications and resources, approaches and techniques, and then also training and events, and that's all occurring through the processes. Another piece of this that is ongoing, and this can be a facilitator or it can also be a barrier, is that we're strengthening our knowledge management culture and our capacity. So as we're going along, we're making sure that there's a culture of sharing information, storing information, et cetera. And then if there isn't that capacity, strengthening that capacity. And then you can see the arrow shooting out to the right. Another piece that we really want to be paying attention to is sort of how we are reaching our users and how we are engaging them. And not only that, once we reach and engage them, how useful are the products, services, events, approaches, techniques that we're using. And then finally, on the right-hand side, we get to our outcomes. And our outcomes are our benefits to users that may be related to knowledge, attitudes, skills, practices, or health conditions. And for this, we have our initial outcomes, which are split out into two categories, which is learning and action. So on the learning side, we're looking at awareness, attitudes, and intention. And then on the right-hand side, we have our decision-making, practice, and policies. And then eventually, we would hope this would flow down into our intermediate outcomes, which are systems improved, behavior changed, and then the long-term outcome that I had mentioned previously. And throughout, we're kind of looking at assessing needs and monitoring, evaluating, and learning. You can go to the next slide, please. When we were developing our model, we had specifically come up with around 42 indicators that mapped very specifically to this knowledge management model. And we had indicators that look at inputs, outputs, and outcomes. The guide that we developed that contains those indicators, was developed in around 2013. And in 2018, a group of us came together and we realized that as the field was evolving, that we really needed to start to think about some new indicator categories. So I just wanted to highlight these briefly for you. And you'll probably recognize this from your own work. There's been a strong emphasis over the past 5+ years on looking at adaptive practice. So we developed a set of indicators related to how you can start to adopt adaptive practice as part of your work. Next, you'll know that there's a strong emphasis also on organizational partnerships. So we wanted to really unpack what makes for a strong partnership and how can we measure that. And then finally, social interaction, because knowledge management isn't just documents or websites, it's a lot of tacit knowledge and very important contextual knowledge is shared through social interaction. So how can we measure that as well? And so we developed new indicators related to that. Next slide, please. So again, I just wanted to highlight for you these two resources. We have a hard copy PDF, and in the next slide, we have a URL for you so that you can access that if you haven't seen it previously. And then we also have a web indicator library, which you can filter and search and find these different indicators as they're mapped both to the logic model that I just shared with you, but also the new indicator categories that I had mentioned. And I believe, okay, so here's for more information. So I'm sure this slide deck will be made available for you. And so then you can check out these websites and URLs to get these resources. But with that, so that's just a little bit of an overview to give you a sense of the big picture for measurement in knowledge management. Now we're going to turn our attention to a specific case example. So I will turn it over to Natalie for the IAPHL example.
Thank you, Tara, and hello, everyone. My name is Natalie Apkar. I hope everyone's doing well so far. So our first example of a KM measurement opportunity that's come up is with the International Association of Public Health Logisticians, or IAPHL. It's an acronym that we struggle with as well, and we've been working with them for a few months now. USAID referred IAPHL to us to help identify indicators for them to measure the progress of their activities towards intermediate and primary outcomes. Go to the next slide, please. So for some background on IAPHL, it is a community of practice that aims to professionalize the field of public health logistics through capacity building and information sharing. And so what their vision is that through this COP, supply chain actors can be sharing knowledge, talking to each other, making more meaningful contributions to help strengthen health supply chains. The COP has grown to be about 8,000 members in more than 152 countries. And they have a platform, an online platform that provides a space for supply chain professionals to engage in knowledge sharing and advice gathering through discussion boards. They're also encouraged to share professional opportunities such as certificate or training programs and new job opportunities. And then the COP organizes webinars and runs social media platforms to help keep members engaged and provide learning opportunities. So the primary outcomes of IAPHL are listed here. There are three main outcomes, as you can see. The first is the one that they've been able to work on the most and have the most activities linked to, which is building a strong network to foster supply chain improvements. So it's the one that includes that peer-to-peer learning and collective problem solving for supply chain problem solving. And then another outcome is elevated voices of those doing the work. So fostering a community where supply chain priorities are, upheld and pushed forward by the actors working on supply chain management. And then finally, the third one, which IAPHL is, it's pretty nascent so far for them. This is something that they would like to work on more in the future, is the advocacy piece. So they have chapters. Different countries are referred to as chapters that are working more locally on the ground. And what they would like to see is these chapters working, advocating with national governments for professionalization of supply chain workforce, and really, seeing how there can be more opportunities for supply chain professionals to grow and have that be supported by the country. Next slide, please. So what did they ask us for? Why did they come to Knowledge Success? The first and foremost is that they're looking to develop and identify robust indicators for use in monitoring and evaluating the COP. So they came to us with, here's our primary outcomes, our intermediate outcomes, our goal, and they just want help with identifying indicators to measure their progress. It also has to do with advising the new secretariat who will implement these M&E the M&E indicators. They're also in the process of developing a new strategy. So there's more levels to that we can discuss in the next couple slides. They also just want to answer the question of what benefit has membership in the COP brought to community members, and what effect has this had on the wider global health supply chain community. So looking at that bigger picture of sort of the so what of their work. Next slide. Oh yeah. So what they're doing currently to measure is they're looking at social media and website analytics. They've done 2 yearly surveys. So in 2021, they did 2 assessment surveys, and you can see the level of participation here was a little low, but as we know, sometimes that's the case with surveys. There was also an assessment carried out by USAID that used an HCD approach, including focus group discussions and interviews to discuss, ask questions about what people are getting out of the COP. And as I said, they're in the process of developing a 3-year strategy. And Sarah Harlan and I joined, we sat in on their meeting where they were joined by Think Place, and they went through human-centered design workshop where they were thinking through what are IAPHL's value adds to the community, and what are the activities that we really want to keep and are strategic for us. So that's in the process, sort of alongside our look at the indicators. Next slide. Yeah, thank you. So how are we responding to their needs? We started out by doing some background reading. So there's a good amount of literature out there on COPs and COP measurement. We started an FP Insight collection on that, which you can check out. And there's a good amount of reading out there that we've been doing. Some of it is a refresher. I think Sarah and Tara are more familiar with this stuff. It's a little bit newer to me. And then we thought it would be easier to see their objectives outcomes and activities in a more visually organized way. So we can show you on the next slide. This is Tara's handiwork. You'll notice on the left-hand side, we have the activities. We thought it would be better to begin with the end in mind, because when IAPHL presented this to us, it was clear that they knew their goal and outcomes, but it was less clear how their activities or interventions drove toward those outcomes. And we could see that, you know, the link wasn't clear to them. So then if the link wasn't clear to them, then it wasn't going to translate to clear implementation. So as you can see, we have the activities placed on the left, and then we're showing how these feed into the outcomes and ultimately the overall goal. So I can just pull out a few here, you know, and the first outcome is in blue, and you'll see like the activities we have listed here: promote timely webinars, support members with scholarships to attend supply chain conferences, promote and manage the listserv, moderate discussions, country chapter workshops. That feeds into IAPHL offering supply chain and health system actors peer-to-peer support and opportunities, and then making IAPHL the go-to place for public health supply chain. That feeds into that overall outcome of strong networks to foster supply chain improvements, then feeding into the overall goal listed there. So finally, this is an excerpt from the M&E for KM and Global Health Manual, which Tara mentioned earlier, how to write up a qualitative result. We've put it here because it's just, we think, really helpful to think about. You know, this is an example of how USAID often funds communities of practice and then questions the investment. They want to know what they're getting for their investment, and the types of activities often cannot be directly tied to health outcomes. So it leaves implementing partners striving to find ways to justify the investment. And so obviously, you know, COP work is not as direct or quick as other types of investments, and therefore harder to quantify. Oftentimes projects wind up measuring reach and outputs and usefulness, but we really want to get at the use and impact on those intermediate outcomes. You know, what is the impact of that reach? So this box about how to write up a qualitative result shows implementers a guideline for thinking about demonstrating qualitative results, and really thinking about, you know, who's using the knowledge, what's happening as a result of the knowledge, and why is it important. You know, these who, what, why, where, and how questions can be really helpful to think about how the assistance or funding is contributing to the achievement of the result, which is important, I think, to think about with this KM measurement. Finally, we have some discussion questions on the next slide, and I might just like take a pause and see what my team members think in terms of time, if we want to do some of these discussions now or have Sarah present.
I think we can go ahead and break for some discussion. I think we're doing pretty well on time.
Great.
Thanks, Tara and Natalie. So COP members, those of you who have logged in, if you can take a minute to share with us, what are some strategies you are using or have used to measure KM's use and impact? So as I mentioned in the chat, I saw that members of Springboard are on. Do you have any examples from your KM projects or activities that worked on where the donors are asking for more details on their investments, and how did you respond and how might we as implementers show CAM's use and impact of health projects? So we're opening it up. You can unmute yourself or raise your hand or answer a question in the chat, but we're looking for your participation. So a question from Jarrett for Natalie and Tara. Can you share the actual indicators that you recommended in the case of IAPHL?
So this is still ongoing. It's work that we're still working on. We had hoped to be a little further along, I think, at this point, but because they are simultaneously working on their strategy revival, that's, kind of been taking up some of their priorities right now. But we are, we're continuing to meet with them and then work on our own developing these indicators. So I don't know if we really have some to share right now, but we definitely could follow up with that in a little bit.
And just to say, I think just to chime in on that, because I opened up we have a big Excel spreadsheet that we're working from. So a few things to point out is that the team actually had a pretty good list of indicators that they had developed already. But one of the things that we found when we looked at their list of indicators is that oftentimes an indicator would be measuring more than one element. So part of what we've been doing is just going through their indicators and making sure that a single indicator is measuring one single thing. The other thing that I'll note is that many of their indicators are actually quite process oriented. And in a second, I'll drop a couple illustrative examples in the chat so that you can see. But maybe that takes us a little off course from the discussion questions. So I'll do that, but maybe we can look at these discussion questions also. It'd be great to hear from any of you all if you're doing any kind of measurement that you're having a challenge with. I think it'd be great just to hear the experience on the line.
Okay, hi, this Kemia Cargo talking. Yeah, so I'm not sure whether I'm really sharing experience or challenge. So I was actually drawn to attend this because this is something we've actually been thinking a lot about as the Springboard team, moving from just measuring processes or activities to like how exactly do we measure impact of what we are doing and what exactly we should be measuring. So to my knowledge, the little time that I've spent with the Springboard team, most of our reporting are not to USAID hasn't been so much about impact. It has been more about the activities. I know we have done some qualitative assessments in the past to sort of like gauge, okay, how Springboard members are able to use what they are gaining from the platform and translate that into their SBC work. Yes, but it's really something we're looking for more, more information on how to do better.
Thank you, Kemi. And what I could speak for the challenge initiative, as we're the CAM sub on that, and they have the TCI University. So we measure and look at and report on a quarterly basis number of certificates earned. So those who kind of engage with the platform and go through the content and complete an assessment. And then we also look at engagement as number of posts to the community of practice. And then we look at a number of other kind of Google Analytics, but in all honesty, we look at those, but they're never really, I don't think anyone else sees value in them other than us looking at them. And then we do an annual survey to try to tease out more around satisfaction with the content and how the content may have been used. But to Kemi's point and what Natalie also said, often the richer data is in the qualitative. And because we do the survey annually, we're noticing that people's responses to the open-ended questions are becoming kind of less specific or really robust. So we're trying to figure out how to get a bit more at that. And I'd say one of the challenges that we're faced is the fact that like, at least the self-reported data around satisfaction and use is already like baseline quite high. So from year to year, it's not like we're seeing a huge change. So that's just something in terms of there isn't a ton of variance. Anyone else can share your experience in terms of what seems to have been useful in terms of measurement or challenges that you're facing in measurement?
I'll just chime in maybe while people are thinking that one of the things that we found working with both groups, and you'll hear more from Sarah Harlan in a minute on this, is that what we found with our donors is that sometimes they really struggle with determining what the value of the investment is, which is what Natalie had said previously, and answering that so what question, which was part of the reason that we had wanted to flash up that really handy dandy box that kind of unpacks ways in which you can write up a qualitative result that helps answer that so what question. And that's something that I'm sure that you all have found, and something that we do quite often, which Lisa just referred to, is just having some quantitative data in the form of a survey and also having those analytics, but also pairing that with doing some qualitative data collection so that you can bring to life and better be able to show how your knowledge management work is being put into use and then translating into hopefully some changes in either people's decision making or in actual practice and programs. So if there isn't anything else, maybe we should move on to our next case example, and we have a couple discussion questions related to that as well. So I'll hand it to Sarah Harlan.
Hi, everyone. Thanks, Tara. So I think this will probably bring up a different sort of discussion. So we'll get into that in a bit. But so I'll talk to you a little bit about the work that Knowledge Success has been doing with the Momentum Knowledge Accelerator. Many of you all are probably familiar with the Momentum suite of awards. They are funded by USAID, and they work holistically on family planning, reproductive health, and maternal and newborn and child health. And specifically, the Momentum Knowledge Accelerator works with the other awards on knowledge management and collaboration, learning, and adaptation. So they sort of connect the systems and tools, they share data, they help advance learning, etc. So here's just a little bit of background on what MKA does. Oh, yes. So that's just basically what I just said. So they focus on, maternal child health, family planning, sort of across the suite of awards. So if you go to the next slide, these are the 4 key domains of MKA. So they work to capture data, harmonize data, facilitate learning and adaptation. They package and share knowledge, and they work to tell one collective story across the various Momentum suite of projects. So what do they ask us for? So you can imagine, since they work across the suite of projects, that they might have some questions about how to get knowledge used and applied. So we started talking with them soon after they were awarded. And as the flagship KM project for USAID's Office of Population and Reproductive Health, as Knowledge Success, we often meet with other projects to work with them on content or other types of activities. But since they're also a KM project like us, our discussion was a little bit different. We started kind of talking about ways that we could work together on knowledge management and combine efforts and help advance measurement of KM and address some of the so what questions that we often get from donors and partners. So with MKA, we talked about ways that we could work together to enhance and measure dissemination so that it goes beyond one-way sharing. And we really have wanted to work on nurturing the use of resources and document more about how the resources are used and applied. So you can go to the next slide. So we have been talking with them over the last few months about doing a pilot study to address the question of the use of resources. So the scope will be fairly narrow. It will focus on use and uptake of resources outside of Momentum. And to be realistic, we've talked about having a light research layer to kind of compare to standard approaches and to document costs and benefits. We also want to connect back to the persistent so what question that we get from our donors and the challenges that we often face in answering that. So in talking with Momentum, we identified some of their implementation challenges. For example, they have different documents, but how do we make sure that people are actually accessing and using and applying the knowledge from these documents? How do we make sure that resources make it to the audiences that they should reach? And how do we make sure that we're addressing different learning styles? So people that learn through reading, people that learn more through data or through videos or infographics, et cetera. And then how do we ensure that once this information actually reaches them in their preferred learning style that it's used? And then how do we measure that in a cost-effective way? So it's sort of all of these very basic KM questions that many of us who have worked in KM for a while have been kind of grappling with. So unlike the work with IAPHL, this work with Momentum Knowledge Accelerator is really more focused on maybe the quote unquote traditional side of KM in terms of producing materials, disseminating them, measuring use, and like less on the peer-to-peer learning and COPs aspect. So, between these two, we've really been working on a lot of different measurement issues within KM, and it's been really fascinating to work on. So we're not quite as far along in this. We don't really have a pilot or indicators to share yet, but we did come up with some discussion questions that we thought might, spark some conversation in terms of these various challenges in measuring reach, use, and application of knowledge products. And we're really interested to hear if you all have experiences with this or, any additional questions. So I will pause there for discussion.
Great, thanks, Sarah. So maybe we can just read through these questions and take them one at a time. What are the challenges you faced when measuring reach, use, and application of knowledge products? So as Sarah had mentioned, as we're working with the Momentum Knowledge Accelerator, they gave like a very specific example that they've come up with some resources. One example is an adaptation guide that they've come up with. And, they posted it on their website, they've disseminated it and done some promotion around it. But are there ways that what they want to know that they could do an enhanced dissemination with? Maybe there's more face-to-face or someone's endorsing that particular product that would enhance its use. So our question to you, just by way of trying to spark conversation in this community, is what are the challenges you face when measuring reach, use, and application of your knowledge products?
So if I may, I don't know if this is going to, but I think it's more of a question really, and I think it tallies with the challenge mentioned. It's easier to sort of mention the products that KM products that you develop within the purview of your, say, project or organization, and probably disseminated or host on your own website or probably on YouTube. But the ones that go to, say, the donor, for example, you really do not have any control as to be able to measure the reach or use of any of such products. or even if you probably hosted on a website like, say, the Health Compass, maybe you developed a KM product you used internally and sort of wanted to give a case study example and hosted on, say, the Health Compass, which is like a resource for others to use. The data is usually domiciled with it's not really external now, but the data is usually domiciled with this platforms, and you really cannot access them. So is there any suggestion as to how this can be better managed, or if there's a way to also get a feedback loop from, because most of the times when we do develop some knowledge management products, they usually go to the donor, apart from the ones we share in the platforms that we have control over.
That is a great question, and I appreciate it. And I do feel like there's a way that it can be tracked, and I'm just wondering if my colleagues on the Knowledge Success Project, or maybe Lisa, you faced this with TCI, but I do feel like there's a way that you could capture it, but I don't personally know the answer to that question. Does anyone else?
I think that's a really great question, especially
Yeah.
for Simone, because I think it's related to like the Google Analytics potentially, and being able to set up, look at referrals or the events indicators, if you will, within Google Analytics. I'm not as savvy with Google Analytics. Like I look at downloads, but not necessarily which sites are referring people to our site. I don't know if others have experience with that. But I've noted that question, so we can follow up with Simone and post. Any other challenges? I mean, one thing that I can think of is that we produce so many materials, like knowledge products. So like how to prioritize or decide what exactly should be measured in terms of reach, use, and application out of all of them. Like, how do we prioritize? I think that's a huge challenge, because otherwise I'm afraid we'd just be inundated with data that we might not actually use. Any experiences with that, or how Momentum is going to try to prioritize its knowledge products for this measurement?
One of the things that we've had a lot of discussion around, which we also have on the Knowledge Success Project, is being able to make sure that we're sending or targeting our audience as well with products that will respond to their specific needs. So that is definitely something that we've talked about and that we do on the Knowledge Success Project. Natalie, I don't know if you want to talk about how we use our automated software to help with that at all.
Sure, yeah. Like with HubSpot and email sending.
Yep.
Yeah, so HubSpot allows us to segment our audience by, we can see how they've behaved with different emails that we send. So based on that, we can, decide or make conclusions about their interests in certain topics. And we're using it for, one of the most simple ways that we use it is if people are unengaged with our emails, that means they haven't opened an email in a certain number of sends. We set the bar pretty high, since we know a lot of our audience has, unstable internet or travels a lot. So I think it's like if they haven't opened an email in 25 sends or something, we consider them unengaged, and then we suppress sending to them so that it doesn't clutter their inbox and they're not getting something that maybe they're not interested in. But then we do quarterly re-engagement campaigns where we send an email to that list with, just some quick highlights of what the project has been doing. And it's kind of like, hey, sorry, we've missed you. Here's some important, blogs that we've posted or updates from the project. And that usually gets a pretty good response. We get around 5 to 8% open rates of those emails, which is an accomplishment when you think about, these are people who haven't been opening emails at all. But yeah, there's other ways we do it too, by, making lists based on people's countries, locations, interests, and sending them specific emails based on that.
I sort of have a rider. I don't know if we should still have time. I sort of have a rider to that question, and this is specific to, it's a peculiar thing for me because of, okay, so if we have KM products developed and we really want to see how people use it internally, that's within the organization itself. Are there any automated ways of actually tracking the use or access to those particular products, depending on, say, for example, peculiar to Nigeria, we host it on the Google Drive, like that's the team drive. And the only thing that I know is I can probably see those who have access to that particular file, but I cannot particularly say this is the number of times this person has that so number of person have accessed this file, or try to download it or something. And if it would have really been great if there is a way one can do that, rather than sending out periodic emails to people to fill out a very short survey and say, oh, have you used this in the last 1 month or something, which would probably have some people who have used it not eventually filling out those forms, and then you're not able to get optimal results of how it has been used. But if there's any experience around, if somebody knows a platform or knows how we can track that automatically without having to sort of ask people question intentionally over a certain period of time, it would also be very useful.
Again, I think this is probably a great question for Simone, so we might need to table that or ask her to come and do a special session on how we can track these analytics a little better. I don't know if anyone else has experience with that they can share. I may take the conversation in a slightly different direction because I'm curious if anyone on the line, this is more on both the intervention side, but also the measurement side. One of the things that we've talked about with the Momentum Knowledge Accelerator is that, oftentimes when you're disseminating, and again, as Sarah had said, this is kind of like your traditional KM, it's a document, it's a resource that you're sending out into the world. Oftentimes it's a very passive dissemination, right? You may post it on your website. You may, do some promotional emails that go out to your audiences. But are there other ways that people on this line have used what we're putting in kind of air quotes and used enhanced dissemination, where maybe you've had a resource and because it's an important resource for your audience, have you put in more time where you've done face-to-face events or any kind of maybe a webinar on it or something that would, or translated it into languages so that you could make sure that there was that uptake in use? Do you have any examples of ways in which you've kind of gone above and beyond the just generic dissemination to help make sure that knowledge gets put into use that's in these resources?
As folks think on that, I can share an example from the Challenge Initiative with their RAISE tool. So it's one of their self-assessment tools. So granted, they do interface with local government to actually use the tool, but also to get it endorsed beyond like TCI. We reached out to Larry Cooley, who's considered a leading expert in the scale up field, and asked him to write I don't know if it's the prelude or like this, some kind of preface or something that basically showed that, he saw value in this tool beyond TCI as it related to like the scale up literature. And then there was webinar in which he spoke at, but also so did the donor, and then experiences from the country using the tool. So I hope that helps. Are there other examples of specific kind of knowledge products that you've used that you found has had greater uptake than others because of your dissemination?
Okay, I don't know whether this photo speaks to what you're talking about. A behavior change team is doing in year 5. So we haven't reached the end, so we can't we're still in the process. So a toolkit had been developed in and some other tools had been developed in year 3 and 4. So in year 5, the team is investing a lot of time in disseminating this. So we've had a webinar, and then we're going to have regional workshops to sort of like a follow on the webinar, so that people who have expressed interest in using the tools can really get really involved in the nitty-gritties, how exactly do the tools work and all of that. So that is also something, so that beyond just posting that the tools are available, going beyond that, actually getting people to know about them and how exactly they can be applied in their context.
That's really helpful, Kemi. Do you have a sense as to how you'll measure the impact of those workshops?
Okay, yeah, so we're still in the process of setting up the workshop. We're still talking about metrics, and then beyond the workshop, we're going to do a follow-on case study. We're going to follow the workshop at participants through for maybe 3-6 months. So part of the workshop, they're going to have to develop a roadmap on how they plan to use the tools, the knowledge they have gained, and how they can apply the tools in their context. And then there's going to be a follow-on after the workshop for some months to see how it all spans out.
Sounds great, and it's interesting because it sounds along the lines of what we've been discussing with the Momentum Knowledge Accelerator. So I know that we have just about 10 minutes left. Let's see, did we talk about this second bullet? How can we show uptake of new resources in a way that responds to donor requests? Or we can go to the third bullet. If there's silence, are there creative ways that you have documented use of resources using qualitative data and quantitative data, or both?
I would say what I find is, like I said, I'd say a lot of external audiences don't really get Google Analytics, or it's not all that meaningful. So the use of infographics to kind of share some of those big quantitative numbers around downloads, but then of course with like at least quotes from users as to how it's been applied, but in very short summaries, like infographics seem to be the most powerful for TCI.
Yeah, that's a great
Sweet.
suggestion, Lisa. I was gonna say, qualitative data and stories about how things have been used have been really helpful for us as well. And I find that to be that resonates a little bit more, at least with USAID, than sometimes just telling the amount of downloads or something. And this is a little bit different, but some of the work that we did with IBP in terms of documenting implementation stories of the high impact practices, that's a little different because the high impact practices the HIP briefs are a whole other beast, but it was interesting and I think really useful, both for other users as well as the donors themselves, to see stories of actually how some of these materials were used in practice. And it gave us a lot of really interesting ideas also for how to promote them better. So it was kind of it had a lot of uses for us.
So one other way, I don't know if this counts though, because I think it probably speaks to 2 and 3, but one other way that in the past that we've used to sort of see how people interact with this product and maybe not necessarily use them, but at least probably accessed and downloaded them, is through dissemination through newsletter. That gives you very detailed analytics, especially if it's through MailChimp. That gives you very detailed analytics on how often they accessed it, even if they did forward the that particular link, if they access the link, how they interacted with each part of the newsletter, including some of the resources that we also share within that platform. And I think that's actually one of the greatest tools that I've used in the past for measuring access and use of some of our materials disseminated through the MailChimp platform.
I think that's a really good point, Balade, in the sense of, I think as public health practitioners, we could learn a lot from how sales and marketing use like MailChimp, or I think Natalie mentioned like HubSpot, more intentionally and effectively than maybe our traditional modes of dissemination have been just blanketed, just get it out to as many people as possible and kind of ignoring the bounce rates or who are kind of the super users. And so I think learning more about some of those strategies employed by sales and marketing using some of those softwares is probably would benefit us more. Anyone else have a final thought or comment? I think this is a really good taste of like the different measurement opportunities, kind of like you said, Sarah, like traditional CAM versus kind of the more peer-to-peer engagement and learning. And it would be great to check back in with you all as those projects kind of evolve in terms of the pilot research findings and what ends up becoming kind of the final list of indicators. So I'm hoping this was a good taste, but more of a preview, and we can maybe check back in with you all as things have kind of come further along. I hope that would be okay.
That would be great. I mean, honestly, we had thought we would be further along when we had planned for this session with you all. So I think it'll be great if we can loop back when we've gotten further along in the process. And I guess the other thing I'll say is that, this is one session on looking at measurement, and some good questions have arisen from this. So if there's interest, we could come up with maybe specific topic areas that we might want to dive into, whether it be web analytics, where Simone would be best placed to give some of her share her wisdom.
Great, that sounds awesome. And I did document those questions, so we'll definitely follow up. And just wanted to thank the 3 speakers immensely and let folks know that our next planned CoP meeting will be for Thursday, June 16th at 9 a.m. We'll be talking about adaptive management. It was your second most requested topic when we did our ranking of discussion topics in January. So we've invited an external guest, Piers Bocock, who used to work with CCP and has started his own company and has done a lot with other implementing partners around adaptive management. And then we'll hear from our own colleague at CCP in Nigeria with working on TCI and how they've employed pause and reflect on a regular basis to inform course correction and adaptive management. So stay tuned to those or that announcement via the Hive. And please plan to attend and let us know via the Hive if you have additional suggestions for topics, or within that topic of adaptive management, if you have specific questions that you'd like for us to share with those speakers. And we can continue this discussion around measurement via the Hive as well, and sharing resources there. So we'll post the slides and the recording later today. Thank you all so much for taking the time to join us. Hope you enjoy the rest of your busy Tuesday.
Thank you.
Thanks all.